Okay, good morning, everyone. Thank you for the introduction, Laura. I am Lindsey Miller. Let me just got it here. And usually my presentations are interactive, but due to some time constraints today, I'm just going to do a lot of talking. And then at the end, we're going to do a quiz. So make sure you keep your brain sharp and you listen to the whole thing. So what do those initials mean? MS means that I have my master's degree in nutrition. LDN means that I am a licensed dietitian nutritionist here in Connecticut, and I'm working on taking insurance, but in the meantime, I can provide super bills for clients. And CNS is Certified Nutrition Specialist. And this is kind of equal to the RD or Registered Dietitian certification. What I needed to do to get a CNS was to have my master's in nutrition, pass a board certified exam, and have 1,000 supervised clinical hours. So a whole lot. And that's what I've been working on. And I opened up BBX Nutrition in September of 2021. And if you guys are interested, ask me after where the BBX came from, besides the body-brain exchange, and why I have Leonardo DiCaprio to thank for my interest in nutrition. That's a story, a longer story, so I'm not going to spend time on it. Okay, so what we're talking about today, first of all, we're going to talk about me a little bit more. Then we're going to talk about digestion, because of course the gut is related to everything in the body. We're going to talk some brain basics. We're going to talk about factors that affect brain health and possible outcomes from these factors. We're going to talk about best practices for brain health, how a nutritionist can help, questions and answers, and then we're going to do a fun Friday quiz. If you have specific questions on something I say or something that's not clear on a slide during the presentation, please ask. Otherwise, please hold your questions to the end. A quick medical disclaimer: everything in this presentation is for informational purposes only. If you have specific questions, ask your doctor, ask me afterwards. Okay, moving along. So I covered a little bit about myself before. So a lot of people know what the RD certification is. That's a registered dietitian. The difference between a registered dietitian and a certified nutritional specialist really isn't that different. Our outcomes are the same. We want everybody healthy. We want to teach people about food. The main difference comes in our training. RDs are educated much more in an inpatient setting, where CNSs are educated for an outpatient clinical setting, which is where I come in. So I practice functional and integrative nutrition. What does this mean? Basically, I work to get to the bottom of the issue. And again, I mentioned the gut before. Almost everything stems from the gut. And integrative means that I work in conjunction with any other medical team members, mental health therapists, etc. Okay, you are what you eat, right? Everyone's heard that before. Well, not quite. You actually are what you absorb. Little story here. One of my neighbor's children came over. This was a couple of years back, and ate one of my kids' Legos. Does that mean that this kid turned into a Lego? Not, right? So I'm sure we've all heard of kids swallowing pennies or dimes or whatever else. You are not necessarily what you eat. There's so much more to the digestion and absorption story than what you're putting in your body. So this diagram is meant to serve as a quick reminder of the GI system, the gastrointestinal system, and how everything in our bodies is truly intertwined. Everything that happens within our bodies is a process, usually cycles of anabolism, which is buildup, and catabolism, which is breakdown. In the case of digestion, catabolism happens first and then anabolism. So we use the building blocks of what we have digested and absorbed as fuel to build everything that we need in our bodies, right? So our bodies constantly work to maintain homeostasis, which means balance, and will always complete the most important tasks of living first. So think breathing, heartbeat, keeping us safe, regulating our body temperature, all of that stuff that we need to keep us alive. If we're providing proper fuel and everything inside is working correctly, then we move on to the next important task, okay? I'd like to explain the HP axes, right? So the HP stands for hypothalamus pituitary. The hypothalamus is basically the center that is telling our bodies what needs to happen. So what happens is something goes from the hypothalamus down to the pituitary, and the pituitary is going to release signals to the next part of the axis, which I'll cover in a minute. And when it does that, it's telling our body what needs to happen. So for the HP axis, the very first one that we have is the HPA, the hypothalamus pituitary adrenals. Adrenals is where cortisol comes from. So cortisol is our fight or flight hormone. We talked about our bodies staying safe. Cortisol is one of the first things that's going to come out if our body senses danger in any way. So we have the HPA axis. Next, we have the HPT axis. You guys are going to get sick of me saying these words. Hypothalamus pituitary thyroid. Okay, from the thyroid hormones that are important for metabolism. However, if we have too much cortisol pumping out, our digestion slows down because all the fuel that we have in our body is going to that first axis. Does that make sense? Mm-hmm. Okay, so then after the HPT, then we have the HPG. The HPG is hypothalamus pituitary gonads. So these are our sex hormones. So they are third in line. So only is the fuel in our body going to the third axis if we have enough for 1 and 2. Does this make sense?
Absolutely.
Okay, great. Okay, so I like to talk about this because I find that malnutrition is often a major issue when it comes to brain health. When I say malnutrition, I don't necessarily mean that someone is not eating enough. I may mean that they're not eating enough of the right stuff. So they're not getting enough of the macronutrients and the micronutrients that they need to help all of these processes in the body. Okay. So quick rundown of proper digestion and absorption. So digestion starts in the mouth. Some people say it starts in the brain. If everyone was to close their eyes right now and think about your favorite food, perhaps your mouth would start watering, right? So that is the beginning of chemical digestion. But for purposes of today, we're going to start in the mouth. So in the mouth, mechanical digestion starts. What is mechanical digestion? It's chewing. So it is imperative that people have good oral health to even begin the digestion process. And a dentist is often the first person that will tell you if something's going on, okay? I have a dentist here in the area, Dr. Schuber. She is fantastic and she loves to talk about this stuff. Chemical digestion also starts in the mouth. Chemical digestion is your saliva, and there's something called salivary amylase, which is an enzyme that's going to start to break down carbohydrates and sugar in the mouth. Then stuff travels down your esophagus through your LES, which is your lower esophageal sphincter, and into the stomach. I mention the LES because this is what stays open for whatever reason, be it physical or something going on in the stomach that causes reflux. So a lot of people are familiar with reflux or GERD. The LES is involved. In the stomach, we have hydrochloric acid that is produced and more enzymes. And hydrochloric acid is so important. Number one, it helps in our immunity. So anything that is coming in bacteria-wise, for example, on our food that's not good, the hydrochloric acid will try and get rid of it right away. Hydrochloric acid is also needed for proper breakdown of fats and proteins. Now, when people have GERD, I mentioned this before, there are two things often that happen. Number one, you don't have enough hydrochloric acid. And if you don't have enough hydrochloric acid, then your LES is not signaled that it needs to close. And so what you do have goes back into the esophagus and causes that. Number two, you might have too much hydrochloric acid, okay? A lot of people use PPIs, which are proton pump inhibitors. So this is like your omeprazole or anything else you might take, sodium bicarbonate, so Tums.
Like the Tums?
Yes.
Yeah, that's what I do.
If you are taking this stuff too much, or you're on a PPI for too long, you are not producing enough hydrochloric acid, and this could lead to things like H. pylori. PPIs are meant to be short term, okay? But I mention this too because a lot of times with the elderly, as they get older, you just stop producing as much hydrochloric acid. The other thing that I want to mention that happens in the stomach is something called intrinsic factor. And what intrinsic factor is basically the taxi that connects to vitamin B12 to take it all the way down to the bottom of our small intestine so that it can be absorbed there. We'll talk about B12 a little bit later. So in the small intestine, there's more digestion and more absorption that happens. There are 3 different parts of the small intestine: the duodenum, the jejunum, and the ileum. And yes, I had to know those for school, which is why I know them. But in each part of the small intestine, there is stuff that is absorbed. So B12 is not absorbed to the very bottom of the small intestine, but vitamins and minerals and everything else is kind of absorbed above. This picture is a picture, it's an example of the microvilli lining the duodenum. Okay, I just want to give a really quick explanation of what the gut should look like. Okay, so think of the whole gastrointestinal system, especially the intestines, as a tube, and the outside of it is like a balloon. Okay, and what should happen is that balloon is solid all the way through, so that not much can get in or out, because our gastrointestinal system is so important in our immunity. Any toxins that come in, we don't want them in our bloodstream, right? So what happens when you have something like leaky gut is that there are little tiny pinpricks in that balloon. And when there are tiny pinpricks in that balloon, then the gut lining starts to pull apart and stuff can escape from the gut and go into the bloodstream. And this is what also happens in celiac disease. So what happens in celiac disease is that pieces of gluten actually are putting pressure on the lining of the gut and opening up those, they're called tight junctions, and stuff is getting out into the bloodstream. And I mentioned celiac disease because only 30% of people with celiac disease have gut symptoms. How crazy is that? Like other people have joint issues, they may get headaches from if they eat gluten, they may have skin problems, all this other stuff. But again, we talked about how everything in the body is intertwined. Hopefully this explains it a little bit. Then we have the large intestine, which is our place of final absorption. This is where most of the water is going to get absorbed. This is where most of the minerals from your food will get absorbed and any molecules left over from digestion. And the large intestine is also the home to the greatest variety of bacteria in our bodies. Has anyone heard of the gut microbiome? Mm-hmm. It is fascinating. I could do a whole other presentation on this, so I'm not going to talk about it too much today. But basically what it is microbes that live in our body that help with things like digestion, absorption, immunity, actually making vitamins and minerals, not minerals, making some vitamins for us, just helping our body, nerve cell regulation in every way. And then of course we have where everything comes out, the anus. I mention this because stool can tell us so much. When I go in to talk to kids about nutrition, they always love how much I talk about poop. Yeah. Guess what? Tell us so much that we need to know. Stool tests, not the most fun thing to do, but they can tell us what sort of bacteria is actually in our microbiomes. They can tell us what enzymes we have and what we might be short on in our guts. They can also tell us if there's other things in our stool that we are not having proper fat digestion, for example. Okay, so really fascinating stuff and fun to talk about for the kids anyway. Okay, so there's also some accessory organs that have to do with the digestive system. These are things like the liver, the pancreas, and the gallbladder. So we covered all the parts of the digestive system. The thing is, all of these parts need to be working properly for the correct digestion and absorption, okay? So why do I focus on the brain? I focus on the brain because I find it so fascinating, and it's wonderful, okay? And I really feel that healing must start from within. And I'm sure any of you that deal with patients or clients know that. You have to believe that you're going to heal, and your mindset has so much to do with what you're able to do with your physical body. If you look down on the bottom, there is Dr. Alia Crum, down on the bottom up here, and I'm happy to share this with anyone. Excuse me. She's fascinating. She is based out of Stanford, and she has done all sorts of studies on perception, okay? One of her studies, if you believe that you are eating organic food, even if it's conventional food, you absorb more antioxidants, and they have the actual blood tests that prove this. Whether or not it actually is organic, it's organic or conventional. If you believe it's organic, you're absorbing more, right? She did another study based on cleaning people, so cleaning ladies and men at hotels, and working with them to change the perception of physical movement. And she worked with them to change the perception of physical movement, saying how much they actually are moving throughout their jobs. 4 weeks later, she went back and their biomarkers improved. So heartbeat, blood pressure, all this other stuff, and they changed nothing else in their daily lives except for that perception. And my very favorite study that she does is called the milkshake study. And this is a study, she brought people in, and she gave them what she told them was a diet milkshake. And then she measured their ghrelin levels. What ghrelin is the hunger hormone that's saying, give me more, give me more. And she measured their ghrelin levels. And it took a while for their ghrelin levels to go down because they thought they were drinking diet milkshakes. A couple of weeks later, she had them come back, gave them the exact same milkshake. It wasn't diet. Didn't tell them it was diet this time, and their ghrelin levels went down so much quicker, just because of the perception that something was diet versus not. So she's got a whole bunch of studies on this. If you're interested, it's really fascinating. Okay, let's talk about the brain. So a couple of fun facts. On average, an adult brain weighs about 3 pounds and has a texture like firm jelly, as you can see here. For a 150-pound person, the brain is about 2% of your body weight. For a 250-pound person, it's 1.2% of your body weight. However, with every heartbeat, arteries carry 20 to 25% of blood to your brain. So think about that, 2% of body weight, yet you're getting a quarter of your blood with every heartbeat. Your brain uses about 20% of the oxygen and fuel your blood carries. So again, everything that you're putting into your body, 20% of it is going to this one organ. When you're thinking hard, it can be up to 50% of the fuel and oxygen in your blood. There are roughly 100,000 miles of blood vessels in the brain. For reference, the distance around the world at the equator is just under 25,000 miles. It's hard to even picture and comprehend sometimes. Adult brain contain about 100 billion nerve cells, and branches connect at more than 100 trillion points, right? This is known as the neuron forest. There are dozens of neurotransmitters, which are just chemical signals. You will see up here some samples of neurotransmitters and what they do. They travel through the forest to form the basis of memories, thoughts, and feelings. Serotonin is your feel-good hormone. Anybody know that you actually have more serotonin in your gut than you do in your brain? So if you're constipated, there's a good chance you may not have enough serotonin. The brain cleanses itself most efficiently during sleep. This is the period when the lymphatic system opens up to let more CSF, which is cerebral spinal fluid, flow through, which flushes out toxins. And last one, this may be a little controversial, we'll see. Studies show that men, on average, have larger brain volume and more white matter, which facilitates communication between the various parts of your brain, while women have more gray matter, where most of the brain processing is done. I don't know. What do we think, ladies? Are we better at processing?
Yeah.
Okay, so some factors affecting brain health. Okay, so exogenous factors are coming from outside of our bodies. These are things like toxins. Environmental toxins could be things like mold, pollution. We might have lead exposure. You might have mercury, excess mercury in your body from either dental work or eating high mercury fish. Depending on your line of work, you may have chemicals from your work, like hairdressing chemicals, or if you work in a machine shop, anything like that. EMFs, which are electromagnetic frequencies. The science on this is kind of just beginning, but it's pretty fascinating. Phthalates, which are in plastics, pesticides, etc. Social life is really important. Lonely people who identify as lonely that are ages 60 to 79 are 3 times more likely to develop dementia than people that don't consider themselves lonely. Loneliness is also associated with smaller brain sizes and poorer executive function skills, okay? Social status, there's so much that could be covered here. Education level, poverty level, where you live, what you have access to, all this stuff is really important when it comes to brain health. Trauma, this can be from an accident or it can be from events that happen in your life. Trauma almost always means you have inflammation in your body. If you don't deal with it, you almost always have chronic inflammation. And then infections. We all know that COVID has led to some issues with brain health. Also things like flu and Lyme's disease. Okay, endogenous are internal factors. A lot of these sometimes cannot be changed, some can, some can't. Genetics is fascinating. I'm just going to talk very quickly about 2 SNPs, which are single nucleotide polymorphisms, which means that your gene is just a little bit different than it's supposed to be, okay? One of those DNA letters is off. So there's the MTHFR SNP, okay? This is pretty common. This means that you have something called less SAMe, and if you're interested, ask me afterwards because this is much more of a longer conversation. But anyway, the SAMe has a specific role in the methylation of phospholipids, which our brain is made up of a ton of fat, and neurotransmitters in the brain. And then the ApoE4 chromosome, has anyone ever heard of this? So if you have a SNP of this chromosome, you are more likely to develop Alzheimer's, okay? If anyone has seen the Chris Hemsworth show that's on, he has this SNP. Okay, so body composition. Poor brain health is more likely in obese individuals and underweight individuals, okay? But body composition, there's only so much we can do. This is made up of so many different things. So, but often there is inflammation in the body, which is why I mention it. Any physiological changes that happen, reduced B12 absorption. B12 is necessary for so much brain stuff. And if you are deficient in B12, which many elderly are, it can lead to irreversible neurological damage. So this is a big one. Arterial stiffening, hypertension, reduced thyroid gland secretions. Then we have the sensorial perceptual changes. These are things like vision difficulty, hearing difficulty, like, can lead to poor brain health. Disease. Any comorbidities relate to brain health. These are things like Alzheimer's, Parkinson's, depression, thyroid problems, cardiovascular problems, chronic kidney disease, fatty liver, etc. As we talked about before, everything in the body is a process. It all has to work together. And then deficiencies, malnutrition. If you are not eating enough protein, you do not have enough of the building blocks to make those neurotransmitters. And if you don't have enough of those building blocks to make serotonin, you cannot then make melatonin. So if you're not getting enough, you're not getting your feel-good hormone and you're not sleeping. Okay. Iron, we all need iron in our blood. This is what gives us the oxygen, carries the oxygen throughout our blood. If you have a deficiency in zinc, this can lead to altered taste. When you have altered taste, you're often not hungry, which then leads to malnutrition. We have, they're called drug-induced nutrient depletions with almost every single pharmaceutical. And there are ways to look this up. There is a vitamin or a mineral that is most likely deficient because it is taking that vitamin and mineral to deal with that pharmaceutical in your body, okay? Vitamin D is really important. Everyone knows about seasonal affective disorder and not getting enough vitamin D in the winter. B12 we mentioned, dehydration. This is another big one, especially with elderly. If you are not hydrated enough, your blood is not flowing properly. And if you remember, 20%, 25% of that blood is going through your brain. Niacin, thiamine is vitamin B1. This is a really big one with people who drink a lot and with alcoholics. This is almost always deficient first and foremost. Folic acid, biotin, selenium, magnesium, and omega-3s. Omega-3s is another really big one. We'll get to why in a little bit. And then hormones, depending on the hormones that are going on in your body, specifically cortisol and your sex hormones. So if you have high cortisol all the time, do we remember what's going to happen? We're not even going to deal with the thyroid hormones or the sex hormones because everything is getting shunted to the HPA axis, right? Okay. And then diet and lifestyle, of course, which is where I come in and help you deal with all this other stuff. So the standard American diet, known as the SAD diet, is highly inflammatory. And this is why I mentioned omega-3s before. Omega-3s are another essential fatty acid, and they are anti-inflammatory. And omega-3s we have to get from the diet or from a supplement. We do not make them in our body. So it is really important that we have enough omega-3s in our body to deal with the inflammatoriness that's going on. Smoking, drinking, drugs, of course, no good. Level of fitness and physical activity has to do with your brain health. Level of mental activity. Intellectual apathy is a major risk factor for dementia. Stress. Are you chronically high stress? We talked about that. Sleep habits. Are you getting enough sleep and are you getting enough restful sleep? Because if you remember, this is when the lymphatic system cleans out all those toxins that are in our brain. Okay, what these risks may lead to, and this is just a sample of what they may lead to, right? Poor sleep, cognitive impairment, dementia, migraines and headaches, any sort of mental health issues, anxiety, depression, mood disorders, apathy, etc., stroke, Parkinson's disease, and comorbidities. And the hard thing is with brain health is that everything is a cycle. So if you have poor sleep, it may lead to poor brain health. If you have poor brain health, it may lead to poor sleep. And so you have to deal with everything. There is a phenomenal doctor. His name is Dr. Dale Bredesen, and he has written a book called The End of Alzheimer's. And what he talks about, he has something called the RECODE protocol. And what he talks about is there are over 40 touch points in the brain that could lead to Alzheimer's. We talked about some of them. And what he does is work with clients to figure out with each client, and it's individual, and this is why it's so important, what is your touch point? So for you, it might be toxicities that's causing this, that might be the number one cause of this. For you, it might be deficiencies, for you, it might be sleep, et cetera, et cetera. So look into him if you have a chance. Okay, and can we see? No. We see that? Yes. Okay. So best practices for brain health. These are dietary examples. So first, eat the rainbow. Fruits and vegetables and provide us with something called phytochemicals. What phytochemicals are they're the chemicals in produce that provide things like color, smell, taste, texture, and they are meant to protect the produce against bugs, insects, whatever. There are so many beneficial properties that come with phytochemicals, okay? So you want to eat as much of the rainbow as you can. You want to buy local and organic when you can. The nutrient density in produce is highest right after it's picked. So another good idea for this is frozen is good here too. I buy a lot of frozen stuff because my kids just rip through everything. I can't keep it. I can't keep blueberries around for longer than a day unless they're frozen. With organic, I don't necessarily expect everyone to eat all organic because it is cost prohibitive for a lot of people. But if you can eat the Dirty Dozen organic, that's great. What the Dirty Dozen is, it's a list put out by the Environmental Watch Group that tells you which fruits and vegetables have the highest concentration of pesticides in them. So things like blueberries, strawberries, kale, there's a whole list, and I can get that to you if you're interested. So eat a large variety of food. This is really important for your microbiome. In each food, there are different makeups of that bacteria that feed your gut, okay? So even if you like apples and that's the fruit that you want to buy all the time, that's fine, but then get a different type of apple every week. So because there's a little bit of a different makeup of a Granny Smith apple than there is from a Rome apple, than there is from the Gala apple, okay? This is a really big one. Most people eat the same 9 meals over and over. So change it up. I have the opposite problem. My husband always complains, you never make the same thing twice. I really like this. Make sure that you're eating enough food. This is really important so that you can take care of all those processes in your body, and that that you have the building blocks for things like neurotransmitters. Eat more plant proteins. I say this because overall animal products can be really inflammatory in the body. Okay, and that is because when animal products react with the gut flora, so what's going on in the microbiome, it creates higher circulating levels of trimethylene N oxide, TMAO, which leads to inflammation, okay? Use spices. So many of our spices are antiviral and antibacterial. Lemongrass is an Asian spice that has been shown to break the biofilm of Lyme's disease. So we mentioned Lyme's disease before, causing neurological problems. Those little guys are smart. What they do is join together. And so when you send in antibiotics, they may not necessarily be eradicated. They may go into hiding for a little while, but they join together to create something called this biofilm. And so they are able to stay in your body. Lemongrass, the spice I mentioned, is actually able to penetrate that biofilm, break up the Lyme, and then you can eradicate it from your body. Limit simple sugars. What do I mean by simple sugars? These are the added sugars. So anytime you're looking at a label and you see added sugars, that's simple sugar. Why eliminate simple sugars? Because they spike the blood sugar in your body. They're easy to digest, and so as soon as you intake them into your body, your blood sugar is spiking up. When you have blood sugar spikes, this can lead to inflammation. Eat complex sugars instead, things that are in fruits. They take a little bit longer to break down, and they keep your blood sugar more even. Okay, so eat broccoli, onions, garlic, citrus. These are excellent for your liver. So these are really important for detox. And when I say detox, we talked about processes before. So detox is obviously anything that comes into your body that shouldn't. But when we have the anabolism, the buildup, and the catabolism breakdown, everything goes through detox. So you are breaking down even estrogen. So you start with estrogen here, you have to recycle it, you have to go through a process, it goes into a metabolite. After the metabolite, then it's processed again, and then you can either get rid of it or recycle it. those metabolites can often be more poisonous to your body than the actual first thing. So like when you are drinking alcohol and you have to go through 2 cycles to get the alcohol out of your body. People that are allergic to alcohol, often Native Americans or sometimes Asians, have a gene that that allow them to detox properly. It's in that middle cycle that is causing all the problems. It's not the alcohol, it's the metabolite of alcohol as they're going into the detox. Eat nuts, seeds, soy, peaches, and grapes. This is excellent for hormone balance. These all have things in them called phytoestrogens. Estrogen is brain protective. And what phytoestrogens do is they mimic the actions of estrogen, so they're actually helping your brain. Eat fermented foods. This has to do with your microbiome. It's helping feed your microbiome and keep you healthy. Eat more fiber. This is another really, really big one. Fiber helps you get out everything in your system that you don't need. It also feeds your microbiome. And consider supplementation as warranted. I'm not going to talk about supplementation today because it really depends on the person. And you have to take into account what pharmaceuticals they might be taking, what's most important. The one thing I will say that I almost always recommend to people is omega-3s and vitamin D. And stay hydrated. We talked about hydration already. Okay. So, best practices for brain health and lifestyle. Number 1, eliminate toxins. So this is any toxins that you know that are in your system or that you are around, get rid of them. Cigarettes, drinking, chemicals, mold, etc., etc. Don't put plastics in the microwave. You guys know this stuff. 2 is joyous movement, okay? And I say joyous movement because a lot of us, when we think about physical exercise, we may not necessarily, oh, I have to go to the gym, I have to work out, but that's not necessarily true. Anytime that you can move more is a benefit to your body. Dance with your grandkids, walk to the bus stop, park in the furthest spot. Every little bit adds up. Don't sit at your desk for 8 hours a day. Drink more water, so you have to get up and pee once an hour. It's going to benefit you in 2 ways, okay? If there's limited mobility, you could do things like arm raises while you're sitting, Tai Chi, swimming, etc. So what physical movement does is increases your endorphins and your BDNF, which is brain-derived neurotrophic factor, which is brain protective. Maintain relationships. We already talked about what loneliness can do. Stay mentally stimulated. This is learning, crosswords, trying a new food, any sort of new experiences. If you normally read a book, listen to an audiobook, and it's just going to start something different in your brain, and it's protective, okay? Reduce stress. This is another huge one. All of us with chronic stress out there, we're hurting our bodies more than we know, okay? Support your adrenals, meditation works here, yoga, whatever you need to do to reduce stress. Connect with nature, get outside. There's lots of new studies that show that just being outside is really good for us psychologically and physically. And talk to your doctor about specific testing. I personally think everyone at the age of 50 should get a cognitive test at the doctor's. That doesn't happen. And why? Our brain, one of our organs that we know takes so much of the fuel from us, should be tested, right? Because all our other organs are tested. This would be things like you could do genetic testing, you could do deficiency testing. 8-OHDG, which is a marker of how your mitochondria is working. And if you remember back to high school or whenever you took science classes, the mitochondria are the powerhouse of your cells, which make energy for your body. And so we need to make sure that they're working properly. Things like homocysteine, which is a factor that is like liquid sandpaper in our blood. And if we have too much of this, then it could be causing all sorts of brain problems. And then there is something called the SAGE test, which is the self-administered gerocognitive exam that you can actually find for free online. Give it to yourself and see where you're at. Okay, so what does a nutritionist do? A holistic nutritionist, which is what I consider myself, is going to look at everything, literally from beginning to end. I want to know everything that's going on in your life. I want to know all your medical history. I want to know about your relationships. I want to know everything, okay? And then for treatment, things like treatment, repletion of nutrients, rebalancing the gut, reducing inflammation, organ support, sleep support, hormonal balance, ridding the body of toxins, and then diet and lifestyle, which is really the big one. Food is medicine, supplementation, stimulation. But what I look to find is, out of all the touch points that we mentioned, what is causing the largest issue? Many of those touch points overlap. If we fix your blood sugar, we're probably going to fix your insulin, we're going to fix your energy levels, et cetera, et cetera. Okay, what does BBX Nutrition offer? Individual counseling, comprehensive treatment plans, virtual education, group sessions, pantry rehab, and personalized meal plans, corporate wellness, and education. Okay, so this is the end of my presentation.